How has COVID-19 harmed everyone? The COVID-19 pandemic has created a roller coaster of emotions for everyone, from the general public to even the higher end celebrities. In the United States, there are states that are more heavily impacted than others, and therefore have more stricter laws about what the residents are then able to do when it comes to public gathering and when it comes to eating at restaurants. Specifically in California, the laws have become more stricter as the amount of COVID victims have increased. And scientists around the world are nonstop studying the effects of COVID and the causes for COVID and the best way to be able to keep everyone safe from it. Although everyone has been impacted by COVID-19, some people have been impacted more, and some people it might even just seem as an inconvenience. Therefore, the speech will discuss the impacts that COVID-19 has had on the medical professionals, patients, and business owners. Starting off with the effects that COVID-19 has had on the medical professionals, most people would assume that the amount of medical professionals would have increased due to the amount of people that want to be getting tested, but the opposite has actually occurred. There have been medical professionals that have had to be laid off because there aren't enough people that are then going in for regular health insurance regarded procedures like dentistry or even just regular checkups, and therefore there are then less people paying for that kind of procedures, and therefore the businesses aren't able to pay for the amount of medical professionals that there are. Now, according to Daniel McDermott and Cynthia Cox, authors of What Impact Has the Coronavirus Pandemic Had on the Healthcare Employment, published on June 16th, 2020, as a result from the healthcare revenue declines in March and April, more than 1.5 million healthcare jobs were lost from February through April 2020. There's been a sharp decline in the amount of spending in the health sector, which has then caused that decrease in the amount of medical professionals that are currently working there, because the businesses, again, aren't able to pay those employees. Now, the medical professionals' jobs are very hectic because they have to try and learn how to then combat COVID-19 and how to work with patients on a daily basis, and they have to be learning on the fly. They don't have much time for preparation. COVID-19 has also heavily impacted patients. Medical facilities are putting all their time and effort into helping with the COVID-19 pandemic, and that means that people are then victims of other diseases like cancer or even just the common flu. There are less people that are then able to help those kinds of patients. And according to Lisa Rosenbaum, author of The Untold Toll, The Pandemic's Effects on Patients Without COVID-19, published on June 11th, 2020, cancer care has been disproportionately affected by COVID-19. The protocol for chemotherapy in regards to the COVID-19 situation is to decrease the frequency of the chemotherapy and to decrease the severity of the chemotherapy, meaning that patients that are then have cancer are less likely to be able to receive the procedures that they need in order to be able to save their lives. So COVID-19 situation has not only harmed those with COVID-19, but even those that don't have COVID-19 at all or have never contracted it, like people that then are cancer patients, can then even still be harmed. Now, some individuals don't realize how significantly COVID has impacted small business owners, and the business owners, there have been over 100,000 businesses that have had to close up. We don't know if that is permanently or if that is temporarily. And according to Ann Schraders and Lance Lambert, authors of nearly 100,000 establishments that temporarily shut down due to the COVID pandemic are now out of business, published on September 28th, 2020, states that there have been, like I had mentioned, that there has been over 100,000 businesses that have had to close down, which is then making the United States less of that small business economy that it's known for, and it's making it more of a larger corporate business economy, which then worries some people because then it's starting to look similar to the Gilded Age, where it was the large corporations that were in control and that there wasn't enough small businesses to be able to create a good competition between the two. Overall, everyone has suffered due to COVID-19, but patients with different diseases have suffered the most because COVID-19 made it difficult if not impossible for some individuals to get surgeries, appointments, or scans that are essential for their survival. So if you have COVID-19, survival rate is about 3%, but you have to then take into account the patients that don't have COVID-19 that then have cancer, and they are very likely going to die if they don't get the procedure that they need, like chemotherapy, which, as we had stated before, the chemotherapy frequency and severity is decreased.